Remember, in marketing, we're always looking at trust, confidence, defenses, and resistance. We're always paying attention to this, to our target market. Because what's going to happen if the trust goes down and confidence goes down and defenses goes up and resistance goes up? Do I have a greater likelihood of getting the business or a lot harder likelihood? A lot harder, okay? So here we go. This is the very first and biggest problem in chiropractic right here. Right what we're getting to cover right now, which is the subluxation and chiropractors promoting a subluxation, and they can treat everything because of this thing called a subluxation. You go to the dentist for your tooth, and he shows you this chart. And he shows you how these different teeth are connected to your stomach. This tooth's connected to your stomach. This tooth is connected to your kidneys. This tooth is connected to your lungs. And let me teach you some more, because you came in for a tooth problem and tooth pain, but let me teach you how that tooth is connected to your digestive system, and I can help you with your digestive system through your teeth. Are you okay with that?
Not so much.
How big of a paradigm shift is that? What's that doing to trust? What's it doing to confidence? What's it doing to defenses? What's it doing to resistance? What are you doing to that person? You're destroying your credibility.
Is that a real chart?
Yes.
Did you see the element thing on the bottom?
Yes, it's a real chart. Yes, it's a real chart. You go to the ENT doctor, the ears, nose, and throat doctor, because you have an infection, and he starts talking to you about how the ear is related to the intestines and your digestive system, and how he thinks he can help you through the ear with a digestive problem you may be having. Are you okay with that? What just happened to your trust? What just happened to your confidence? What just happened to your defenses? What just happened to your resistance? Do you even want him fooling with your ear infection right now? You go to the hand surgeon because your hand hurts from carpal tunnel pain. And he says, by the way, I can help your thyroid problem. There's a meridian right here in the hand that'll help with your low thyroid count. So you're going to go to him for thyroid problems now. You're going to go to the hand surgeon for thyroid problems now, aren't you? What did he just do to your trust? What did he just do to your confidence? What did he just do to your defenses, resistance? Do you even want him dealing with your hand right now? Do you? You go to the podiatrist, and he shows you this chart, because you go to the podiatrist for your foot pain. And then when he pulls out, he shows you this chart. And he says, I can help you with your spleen. There's a little meridian right there in your foot that I can help with your digestive and spleen problems and your immune problems relative to your spleen. Okay? Whether you do or don't have spleen problems. You feeling warm and fuzzy right now? You feel like you're enlightened? Or did he just violate your trust? Do you even care? Is that why you're there? Is that why you're spending time or money? You're there for your foot. What did he just do to your confidence? What just happened to the confidence? What just happened to your defenses as a patient? What just happened to your resistance? Do you even want him fooling with your foot right now? Do you want to refer your family members to him now? You go to a massage therapist, and she says, oh, I can do massage to help your digestive disorders and improve your immune system. Because that's why we go to a massage therapist, right? Is to increase our immune system, right? So you go for the massage, your muscles. She's talking about your immune system, trying to educate you on that. What'd you just do to your trust? What'd you just do to your confidence, resistance? Do you want to put your clothes back on and get out of there? And then you go to the chiropractor's office for back pain. And then he shows you this chart. And he says, that bone is connected to your digestive system, which you weren't there for. You were there for back pain. What did he just do to your trust? What did he just do to your confidence? What did he just do to your defenses? And what did he just do to your resistance if you're the patient? Do you even want to get treated for back pain now? A little close to home there, wasn't it? I heard you laugh on every other chart. I didn't hear much laughing when we pulled up the chiropractic chart. Did anybody else notice that? I didn't hear much laughing. A little close to home, isn't it? And you all probably have that chart sitting in your office to some degree, and you don't know how you're destroying your business and your credibility, and nobody's coming in for those problems. Any questions about that? So the very first thing you have to stop doing is creating paradigm shifts. If they come in for neck pain, that's what you should be talking about. If they come in for back pain, that's what you should be talking about. And how it heals and how you're going to heal it. And if they don't come in for those reasons, then that's not what you should be talking about, because that's not why they're coming in after 130 years.